learners, welcome back to English Learning Easy podcast. I'm so happy you're here with me today. If you've ever visited a doctor or looked at a medical report, you might have noticed a lot of short words and letters that don't make sense, like BP, CBC, or ICU. These are medical abbreviations, and doctors, nurses, and hospital staff use them all the time to save time and stay clear. But for English learners, these can be confusing and even scary, especially when it's about your health or your loved one. That's why today's episode is super helpful and practical. We are going to learn 50 commonly used medical abbreviations, their full forms, and what it means in simple English, so that you'll never feel lost in a hospital again. You can repeat after us and take notes if you like. Let's get started. I'll read each abbreviation and then explain what it means and where you might see or hear it. Number 1. RX.
RX stands for prescription. It comes from the Latin word recipe, which means to take. Doctors use this when writing medicine orders. For example, RX paracetamol 500 milligrams means the doctor has prescribed that medicine for you.
Number 2. DX.
DX stands for diagnosis. It refers to the identification of a medical condition. For instance, if a patient has a fever and cough, the doctor may write DX flu after examining them.
Number 3. TX.
TX means treatment. It's the plan or action taken to manage an illness. So TX, antibiotics for 7 days, means the doctor has planned to treat the condition with antibiotics for a week.
Number 4. HX.
HX stands for history. In medical records, this refers to a patient's medical history. For example, HX diabetes means the patient has a history of diabetes.
Number 5. FX.
FX means fracture. It's used when a bone is broken. For example, FX left arm indicates a fracture in the left arm.
Number 6. BP.
BP stands for blood pressure. It's a vital sign that shows how much pressure the blood is exerting on the walls of the arteries. A normal BP is around 120/80.
Number 7. HR.
HR means heart rate. It measures how many times the heart beats per minute. For adults, a normal heart rate is between 60 and 100 beats per minute.
Number 8. ECG or EKG.
Both ECG and EKG stand for electrocardiogram. This is a test that records the electrical activity of the heart to check for any problems.
Number 9. ICU.
ICU stands for Intensive Care Unit. This is a special area in a hospital where patients with serious or life-threatening conditions are closely monitored.
Number 10. OPD.
OPD stands for Outpatient Department. It's the part of the hospital where patients go for consultation and treatment without being admitted.
Number 11. IPD.
IPD means Inpatient Department. This is where patients are admitted and stay in the hospital for treatment and observation.
Number 12. NPO.
NPO stands for Nil per os, a Latin phrase meaning nothing by a mouth. It means the patient should not eat or drink anything, often before a surgery.
Number 13. PRN.
PRN stands for pro re nata, which means as needed. So if a medicine says take PRN for pain, you take it only when the pain occurs.
Number 14. QID.
QID means 4 times a day. If a doctor prescribes medication QID, you should take it 4 times in a 24-hour period.
Number 15. BID.
BID means twice a day. It comes from the Latin bis in die. So, a BID dosage means take the medicine 2 times a day, usually morning and evening.
Number 16. TID.
TID means 3 times a day. It comes from the Latin ter in die. So if you're told to take a medicine TID, take it in the morning, afternoon and evening.
Number 17. OD.
OD means once daily. If your prescription says OD, take that medicine just once a day, usually at the same time every day.
Number 18. SOS.
SOS means if necessary. It's used when a medicine should be taken only in emergencies or sudden symptoms. For example, painkillers may be marked SOS.
Number 19. STAT.
Stat means immediately. It comes from the Latin statim. If a doctor writes, give oxygen stat, it means the patient needs oxygen right away.
Number 20. CO off.
CO off stands for complaints off. It's used to describe what the patient is experiencing. For example, patient CO off chest pain means the patient is complaining of chest pain.
Number 21. SOB.
SOB stands for shortness of breath. It's a common symptom in many conditions like asthma, heart failure, or lung infections. If someone is feeling breathless, a doctor might write SOB noted on exertion.
Number 22. BMI.
BMI means body mass index. It's a number calculated from your height and weight to assess if you're underweight, normal, overweight, or obese. For example, a BMI of 22 is considered healthy.
Number 23. CBC.
CBC stands for complete blood count. It's a common blood test that checks the levels of red cells, white cells, and platelets to detect infections, anemia, and more.
Number 24. BUN.
BUN means blood urea nitrogen. It's a lab test that helps assess kidney function. High levels may indicate kidney problems or dehydration.
Number 25. CR.
CR refers to creatinine, another marker for kidney function. When creatinine levels rise, it may suggest the kidneys aren't working properly.
Number 26. LFT.
LFT stands for liver function test. It's a group of blood tests that show how well your liver is working. It checks enzymes, proteins, and bilirubin levels.
Number 27. RFT.
RFT means renal function test. These tests include BUN, creatinine, and others that show how well your kidneys are filtering waste.
Number 28. O2 SAT.
O2 SAT stands for oxygen saturation. It tells us how much oxygen is in your blood. A healthy level is usually 95% or above.
Number 29. WBC.
WBC means white blood cell count. These cells fight infections, so high WBC levels often mean there's an infection or inflammation.
Number 30. RBC.
RBC stands for red blood cell count. These cells carry oxygen through your body. Low RBC could mean anemia, while high levels may signal other issues.
Number 31. HGB.
HGB is short for hemoglobin. It's the protein in red blood cells that carries oxygen. It's often measured in a CBC test.
Number 32. HCT.
HCT means hematocrit. It shows the percentage of red blood cells in your blood. Low HCT could point to anemia.
Number 33. PLT.
PLT stands for platelets. These help your blood to clot. If your PLT count is too low, you may bruise or bleed easily.
Number 34. CXR.
CXR means chest X-ray. It's a simple imaging test to check your lungs, heart, and chest area. Often used when someone has a cough or chest pain.
Number 35. MRI.
MRI stands for magnetic resonance imaging. It uses strong magnets to take detailed images of organs and tissues. It's helpful for brain, spine, and joint issues.
Number 36. CT.
CT stands for computed tomography. A CT scan takes detailed cross-sectional images of your body and is often used in emergencies to detect bleeding or internal injuries.
Number 37. USG.
USG means ultrasound sonography. It uses sound waves to create images of organs, often used for pregnancies or abdominal issues.
Number 38. DNR.
DNR stands for Do Not Resuscitate. It's a medical order that tells doctors not to perform CPR if a patient's heart or breathing stops.
Number 39. PO.
PO means by mouth or oral. So if medication says take PO twice a day, it means take it by mouth 2 times daily.
Number 40. IV.
IV stands for intravenous. This means the medicine or fluid is given directly into a vein through a drip or injection.
Number 41. IM.
IM means intramuscular. It's a type of injection given deep into a muscle. For example, tetanus shots are given IM.
Number 42. SC.
SC stands for subcutaneous. This means an injection just under the skin, like insulin shots for diabetics.
Number 43. Q4H.
Q4H means every 4 hours. So if your medication says take Q4H, you take it once every 4 hours, even at night if needed.
Number 44. AC.
AC means before meals. It comes from the Latin ante cibum. So a medicine marked take AC should be taken before eating food.
Number 45. PC.
PC means after meals. It comes from post-cibum. So PC meds should be taken right after eating food.
Number 46. NV.
NV stands for nausea and vomiting. It's commonly written in charts when a patient is feeling sick or throwing up.
Number 47. DC.
DC means discharge or discontinue. For example, DC patient today means the patient is being sent home. DC medication means stop giving it.
Number 48. FU.
FU stands for follow-up. This tells the patient when to return to the doctor. For example, FU in 1 week means come back in a week.
Number 49. DM.
DM is short for diabetes mellitus. It's a chronic condition that affects how your body processes blood sugar. It needs ongoing care and monitoring.
Number 50. HTN.
HTN stands for hypertension, also known as high blood pressure. If not managed, it can lead to heart attacks, strokes, or kidney damage.
And with that, we learned about 50 important and most commonly used medical abbreviations. Hope you enjoyed learning. Understanding these terms can really help when you're visiting a doctor or reading medical reports. It's not just about speaking better English, it's about feeling more confident and informed about your health. If you found this episode helpful, we'd love it if you subscribe to our channel. And don't forget, you can always replay this episode for practice. The more you listen, the more natural these terms will feel. Thank you so much for joining us today on the English Learning Easy podcast. Keep learning, keep growing, and we'll see you in the next episode. Until then, take care and stay healthy.